Laparoscopic live donor nephrectomy, a patient-oriented guide to kidney transplant donation surgery, performed by Dr. Chandru Sundram, narration by Chris Southwood. Patients anticipating donating their kidneys will undergo certain medical tests before the operation. The workup includes a detailed CT scan to examine the vessels of each kidney and other aspects of the anatomy ranging from volume to shape to location. Blood work will be done to determine the function of the kidneys, and every effort is made to leave the better functioning kidney with the donor. Though this is a significant operation, the vast majority of patients at Indiana University recover without serious life-changing complications. Over the last 10 years, not one single patient has died. This image illustrates the major anatomical structures that will be encountered during the surgery. Starting at the top, the adrenal gland sits above the kidney. The adrenal gland is
Hypoglycemia is a condition that causes blood sugar level to drop dangerously low. It mostly shows up in diabetic patients who take insulin. When recognized early, hypoglycemia can be treated successfully. This patient education program will help you understand what hypoglycemia is, how to recognize its symptoms, and what can be done to prevent and treat it. Blood sugar. The body needs energy to function. The food we eat fuels our bodies. After digestion, some of the food is transformed into a sugar called glucose. Glucose is the body's main fuel. All functions in the body need glucose, especially brain functions. The brain can become damaged very fast if it does not receive enough glucose. Food that contains sugar and starches is called carbohydrates. The body gets most of its glucose from carbohydrates, including bread, potatoes, and rice. We eat other kinds of sugars in addition to carbohydrates. Examples of these include fructose, mostly in fruits, lactose, mostly in milk, galactose. During digestion, glucose is absorbed into the bloodstream, which carries it to every cell in the body. Unused glucose is stored in the liver as a substance called glycogen. The level of sugar in the blood is measured in milligram of glucose per deciliter. The normal range for blood sugar is about 60 to 120 milligrams per deciliter, depending on when the person being tested last ate. If the person is fasting, their blood sugar could fall below 60 milligrams per deciliter and not indicate a serious abnormality or disease. Blood sugar levels below 45 milligrams per deciliter usually indicate disease. Hormones control blood sugar levels. Hormones made by glands that flow in the bloodstream and control bodily functions. Insulin and glucagon are hormones that regulate blood sugar levels. The pancreas. much or too little insulin or glucagon can cause blood sugar levels to be abnormally high or low. Low blood sugar is called hypoglycemia, and high blood sugar level is called hyperglycemia.
Percutaneous suprapubic cystostomy. Any catheter that can be used as a central venous catheter can be inserted suprapubically with the Seldinger technique. Enter the bladder with a syringe and needle. Confirm location by aspirating urine. Remove the syringe and pass the guide wire through the needle into the bladder.
What we're going to do to treat the disease in children and adults. So we're going to call this course Histio 101. You might think of it as the overview.
Cataracts are now the #1 cause of difficulty driving at night and increased glare while driving. Now, the lens is a clear structure located behind the iris that allows us to bring objects into clear focus at a variety of distances. A cataract, then, is a cloudy, hazy, or opaque region of the eye's natural lens.
Laparoscopic live donor nephrectomy, a patient-oriented guide to kidney transplant donation surgery, performed by Dr. Chandru Sundram, narration by Chris Southwood. Patients anticipating donating their kidneys will undergo certain medical tests before the operation.